Welcome to Perfectly Planted Podcast. I am your co-host, FSCAI. If this is your first time joining us, welcome. If you're part of the Perfectly Planted community, we welcome you back and we hope you enjoy this episode of Perfectly Planted. Daphne, how are you?
FSCAI, I am doing great. Welcome, everyone. It's great to see you again.
It's so good to see you too, Daphne. Daphne, we have a special guest with us today, and we've had this guest with us in the past, Dr. Abena Osei-Wusu. Our focus this month is really on heart health and heart health awareness, and specifically in female. And we thought, what perfect guest to have back than Dr. Abena. So we'll get to Abena for 1 second. I know we have a couple, we have so many things to cover with her today, but Daphne, can you provide a little bit more of, the importance of heart health?
So this is something that's near and dear to all of us because one, not only have we focused a lot on general cardiovascular health and prevention of cardiovascular disease on Perfectly Planted, but more importantly, cardiovascular disease is the number one killer of women. And we want to make sure that we give you an opportunity to be educated, to be empowered, and to understand how you can prevent disease. And if you have disease, meaning heart disease, or you're at risk of heart disease, what steps you can take to reduce your risk or even reverse disease. Just a couple of quick facts, and then I want to let FSCAI introduce our special guest. So cardiovascular disease kills more women than all forms of cancer combined. But a large majority of women don't recognize that cardiovascular disease is actually one of their greatest threats. We could probably have a full episode on the relationship between maternal health, nutrition, cardiovascular disease, but cardiovascular disease is the number one killer for new moms. But I think the reason we're here is that most cardiac and neurological events like stroke can be prevented through education and lifestyle changes. And we'll talk a little bit about those in detail, but it's the pillars that we've been focused on for the past 2 years. Add more plants to your plate, move more, stress less, know your numbers, and find amazing people to connect with like FSCAI and Abena.
That's right. No, Daphne, it's absolutely it. And let me just jump right into this gorgeous woman on our screen here. Dr. Abena Osei-Wusu has been on our podcast before in a previous episode, but she has she's committed to improving the health of global communities as a clinician, advocate, and drug developer, reflected of her core principles of health service and global citizenry. Her focus on cardiovascular diseases and interventional cardiology has excelled her career in clinical research, including coronary interventions, invasive hemodynamic assessment of heart failure, and valvular heart disease, non-invasive cardiology. She has a focus on risk factor modification for cardiovascular disease prevention. As if that's not enough, she's been self-professed plant-based foodie, whose vegan journey began in 1997. The last time we covered everything from her favorite dish to her latest fashions. I know she's wearing one of her own as well. Welcome back, Dr. Abena. It's so wonderful to have you back with us.
No, thank you so much, FSCAI, for that really amazing introduction. Like, that was a mouthful. Thank you for setting it up so nicely. And Dr. Daphne, thank you for, laying out some of those facts so clearly about cardiovascular disease and cardiovascular health in women. This is something that I'm extremely passionate about. And as a board certified cardiologist, I certainly saw the gamut of cardiovascular diseases, but the disproportionate impact on women and underrepresented minority groups is definitely there. And as a subspecialist, even within cardiology, as an interventional cardiologist, you see how that gets magnified. So 100% agree, this is that, ounce of prevention versus a pound of cure. And yeah, I'm all for having discussions about how we can really prevent disease rather than kind of doing the cleanup after, you start having manifestations.
100% agree. And Dr. Abena, we have not had a chance to catch up with you since you were here in episode 8, which is back in September of 2021. What have
Wow.
you been up to before we get into the nitty gritty? What
Yeah.
have you been up to? And kind of just give everyone a summary of what's happened the past 2 years.
First of all, I can't believe that it was that long ago. As they say, like the days are long, but the years are short. Yeah, is that it? Yeah, I think it is. But yeah, it was quite a while ago, and yeah, I think September 2021, we were all still very deep into the throes of the COVID-19 pandemic, and while it has not gone away, I think we are managing a bit differently right now, right? And I think everyone's lives have become a bit busier and a bit different since that time for sure. And I'm no different, So I'm busy doing the mom thing with my almost 6-year-old, my husband. We're all trying to find our way in this new normal. I would say one of the things that I spent a lot of time on in the last year is building my brand. So I think, when we last spoke, I was wearing one of, the things that I made, which I am again today, but this is the first time really where I'm taking my designs and I'm putting them in the hands of people like pattern and sample makers and actually building that brand. So that has been a lot of work, and that's kind of like my other baby right now, and looking to launch later this year. And it's eponymous. It's named after me, Abena A Designs. It's African-inspired luxury women's apparel. And yeah, stay tuned to see what happens with that. I hope you don't have to wait too much longer.
Well, congratulations.
Thank you so much. And then all the other stuff,
Yeah,
work
right.
and food and Instagram, and I don't know how y'all keep up on social media, but I'm like, I can't keep up. And as much as I love to share, sometimes I step away for long periods of time and take my little breathers and come back. But yeah, I mean, just making a way through life, and taking time to enjoy my family and friends and the people that I value, and have those experiences despite all of the challenges, right?
Awesome. Well, we are looking forward to seeing your brand launch, and we all follow you on social media. So can't wait to
Thank
see what
you.
beautiful designs are going to be available for everyone.
Right
So
on.
keep us informed.
We'll do. Thank you.
But let's talk a little bit about heart health. So, we shared a little bit about some of the key pillars for Perfectly Planted, which actually align with Life's Essential 8. Talking about eating better, we all encourage adding more plants to your plate, being more active, not smoking. Can you share a little bit about, from a cardiologist perspective, how the American Heart Association's Essential 8 translates into real lives for women and families?
Sure. And so fantastically, you just listed off several of the Life's Essential 8. And this really was a springboard from what used to be the Simple 7 or the Essential 7. But what was really important that they added was sleep.
Mm-hmm.
So understanding how sleep and your sleep habits and your sleep health play into, your cardiovascular health actually was something really important to add to this. So making sure that you get adequate restorative sleep, and that you understand any potential sleep issues that you might have. For instance, obstructive sleep apnea is one that is quite common, typically underdiagnosed and undertreated, and can frequently be associated with things like elevated blood pressure or hypertension, as well as abnormal heart rhythms, right? And heart disease in itself. So it really is about managing risk factors. So that's things like your blood pressure, your blood sugar, your cholesterol levels, as well as the habits. Because as you mentioned at the outset, we really know that a lot of cardiovascular diseases are truly preventable. And it's unfortunate that, just as a marker of kind of how the society has evolved over time, we eat more processed foods, we move less, et cetera. Our risk of cardiovascular disease has increased. And sadly, many of the gains that were made through innovation, new medications, new procedures, et cetera, have been lost. So imagine now that we're in 2023 and people may actually have worse cardiovascular outcomes than they did decades ago. So it really is important. And thank you for flashing some of these, weight management. And we're not talking about weight in terms of vanity, right? My discussion with patients is always that you want to be at a weight that is healthy for you, and this has to be individualized. If you have excess weight and it does things like, let's say, affect your metabolism or make you insulin resistant or make you develop high cholesterol levels, et cetera, then that's not a healthy weight for you. Now, there may be others who might be able to have more weight and not experience that. But for instance, if you have any of these things, you have to pay a bit more attention to your weight. And I'm a prime example. I think most people would not look at me and consider me to be overweight necessarily, but where I carry my weight, which is centrally, is not helpful from a metabolic standpoint, right? So I have a little less wiggle room in terms of that extra 5 to 10 pounds than maybe somebody whose weight is distributed differently, because that visceral fat, that fat that surrounds your organs, we know is very metabolically active. And if I can prevent it, I don't want to become diabetic. I don't want to have high cholesterol levels, and I don't want my pressure to become elevated or poorly controlled. So that is, and I'm taking time to speak about this because I know weight has become a very sensitive issue, and rightfully so, because I think sometimes our view towards it was not healthy, not helpful to patients. But the context is that your weight should support your health. And if it doesn't, you have to address it. It's really, really that simple. Things like smoking, nobody should be smoking anymore in 2023. I'm sorry. But also vaping. A lot of people went from, okay, well, I'm not going to smoke, but maybe I can vape. Listen, tobacco use is an addiction. We understand it, and it should be managed as such. So people should really seek help if they really are having a challenge. But we know that the vaping is also very unhealthy for your lungs, right? People have even required lung transplant just due to the poor regulation of the substances that are in the cartridges. So we talked about your typical risk factors of blood pressure, high cholesterol, and blood sugar. We talked about tobacco. We've talked about weight. We've talked about sleep. Physical activity is another thing that's really important. So be more active. And what does that mean? I think it means something different for everyone. And we have to also be sensitive to the fact that, does your environment support your ability to be active, right? So, I happen to live in an area where I can walk on a sidewalk. There's sidewalks near my home, not too difficult to do. Maybe not everyone has access to that, depending on where you live. It might be a rural area where it's not safe for you to, walk on the roads, or there's no sidewalk, or even in an urban area, we can face the same thing. But what I tell people is, you'd be surprised at what you can do in your own home, right?
Agreed.
There's a lot of free content from a lot of the cable providers, et cetera, that are walking programs that you can do directly in front of your TV or whatever mobile device that you're using. I'm a Peloton enthusiast. It's not for everybody. 500 rides today. Let me just put that out there.
Congratulations. I saw that.
Congratulations.
That works for me. And what I say is my philosophy towards this is very similar to my philosophy towards foods. Those things that are healthy for you, do those things in abundance. If you don't like tennis, don't go and pick up a tennis racket. This is not the time, right? So find physical activities that you are interested in, that are engaging to you, that you find joy in, and engage in them, right? And we want to be doing it the majority of the week, at least 5 days a week, 30 minutes a day. It's very important to stay active. And we know actually there's a link between physical activity and your mental status as you age, i.e. your memory, et cetera. So that's important. And of course, food. We wouldn't be here on Perfectly Planted unless we were going to talk about food. And, you have all these plant-based enthusiasts here. I've been vegan now for over 25 years. And we have a lot of data that shows how plant-based diets actually improve cardiovascular health. Like one of the biggest studies that was ever done in cardiovascular disease, hypertension, which is a form of cardiovascular disease. You should know if you have the pressure or high blood pressure, you actually already have cardiovascular disease. But one of the biggest studies was the DASH study, which was dietary approaches to stop hypertension. And this looked at the diet that could reduce blood pressure. And essentially, it's a plant-based diet. Now, it did allow for small quantities of animal protein, but we're going to put that to the side. The reason why it actually was effective in lowering blood pressure is because of the plant component. And there's a significant amount of potassium and vasodilators, elements that you eat in foods that can help to open up blood vessels. And this, in addition to maybe some really modest weight loss that was associated with being on this diet, led to significant decreases in blood pressure, which were as effective as adding an additional medication, right? And so this is important because many people don't want to be on medicine. And here's the thing, if you don't want to be on medication, you got to do some extra work. And this is kind of part of that extra work. And frankly, I will tell you, if you do it long enough, it will become a habit. But it's really important to think about, as much as I enjoy eating for the sake of eating, that our eating also serves a purpose, right? And we can eat in such a way that promotes health and is still enjoyable. I should underline that. Or we can eat in such a way that detracts from our health. And I don't think there's anyone out here that is really interested in making their health worse, right? No one is really thinking like that. I think a lot of the time we just don't know that when we make those choices, they're having impact on things like our blood vessels, our brain, our kidneys, et cetera, right? But we need to draw those linkages. So that was a lot to say, but this is really simple language to kind of help people to integrate healthier habits into their daily lives so that they can have improved cardiovascular health.
That was fantastic. I loved how you integrated some of the things that you do. Because I think it's important. It's not that we're just preaching one way. It's that we've actually adopted some of these aspects and essentials in our lifestyles that have helped us and have made us feel better. I mean, I know that I have several people that come up saying, why, how are you energetic? You don't drink coffee. I'm like, well, because I sleep. I actually prioritize sleep in my day. So, and it's not, it is. But Abena, I do want to know, like, we love learning. You mentioned some of the things that you do, but what does a day in the life of Dr. Abena look like? And let's be real. We know you have an almost 6-year-old, right?
Yes.
Yeah. So we know that your hands are full. But, it's like we love to learn, and it's both the activity, timing of wake up, the nutritional aspect too. What do you eat? So, we want to know.
I mean, it's interesting. And what you said about prioritizing sleep, I think is really important. So I prioritize a couple of things outside of my family, which of course is typically my number one priority. I do also prioritize sleep. Even when I was a practicing interventional cardiologist, people would ask me the same. I have not had coffee since 1997, not meaningfully. Like I do not drink coffee. In fact, I don't drink caffeinated beverages. So it's always a query about, well, how do you wake up in the middle of the night and do invasive things to people and you're not groggy? I always prioritize sleep. So I need a minimum of 7 hours. 7.5 is like a sweet spot for me. 8 might be a little bit too much. But I know that I need to get in bed early enough to get that, or I'm not at my best.
Right.
We were talking about this week. We were a little understaffed at home, so my sleep was a little bit irregular. And when I say understaffed, I mean my partner, my husband was not here. And so I was doing more. And of course I realized how much having him around, because he's very active in our household and he is, beyond a helpmate, how it helps me to prioritize some of these things that are very important to me, like sleep and exercise. So exercise would be my other thing that I really prioritize. And why do I do that? I feel better when I exercise, number one. Number two, my health is better when I exercise. So my aerobic capacity increases, meaning how I can perform during exercise, but that has a significant impact on my blood pressure. It lowers it. It lowers my heart rate. And those two things kind of affect how your heart sees stress, essentially, right? So it's having direct physical effects, but I certainly have mental health impact from exercising, and that I feel better from a psychological standpoint. And so that is the reason why in 2 years, I have not missed a week of exercising, according to Peloton, right? It's like 104 weeks, 105, whatever it is. And I've prioritized it because I noticed that. And it wasn't that I was inactive before, but the consistency led me to feel a certain way consistently.
Right.
And so I continue that. And it's not, for me, actually, it's majority maybe riding the bike, but I do a lot of strength training as well. Because as we get older, that's also very important. I know you're very passionate about that too, Dr. Daphne. So strength training is also really important to me. So let me tell you what happens on a good day. I wake up. I might do a 5-minute morning meditation just to kind of get my mind right. That's also on the Peloton app. But there are many, free or inexpensive apps where you can find things like meditations. And I do a meditation because I find it also helps to set the intention for the day. It helps me to kind of bring it in, discard whatever was there from the day before, and move into my day a little bit better. And I feel when I don't do the meditation, I usually engage in about an hour minimum of exercise. Sometimes if I can't get it all in, I might break it up. But the best thing for me is to start my day with exercise. I prefer to exercise fasting. That's just me because I'm not a breakfast person. And it's hard for me to get it in at any other point in the day. When I say I'm going to exercise in the afternoon or in the evening, it's far less likely to happen. So that's how I start my day. As I mentioned, I'm not so much of a breakfast person. I'm more of a brunch kind of girl. So I might do a late breakfast. And when I do a late breakfast, frequently I like to break my fast with something light. So if I work out, particularly if I do strength training, I might have a vegan protein shake just to kind of help. And it helps with the hangerness. I don't know if you all deal with that when you exercise, but strength training makes me very hangry. But a protein shake kind of helps with that. And often I'll break my fast with that. Otherwise, I might do something light, like just some fruit. I don't like the feeling of something really heavy in my stomach early in the day. And then maybe out. So that might be something small. And then I might have something small again before lunch, or I might just move right into lunch. If it's something small again, maybe it's like oatmeal. I've gotten really into this chocolate oatmeal that I've been making, which was inspired by something that I thought, frankly, when I ate it, tasted like dessert, right? It was overnight oats and was chocolatey and had a lot of sugar. And I've just been making, a version that has less sugar, but it gives you fiber. It gives you some fat. I put some nut butter of some sort in there with it. I get some flax, to get my omegas in there, as well as the healthy carbs from the oatmeal. The cocoa, whether it's cacao or actually cocoa that I'm using, some antioxidants. So again, when I'm eating, I'm also thinking about how is this fueling me? And also, is it enough sustenance, right? Is it enough fiber, typically protein in it, that I'm going to be satiated until the next meal? I tend to have my heavier meal midday because, again, as I've gotten older, I realize I can't just be eating all willy-nilly. I can't have that heavy meal, in the evening because it shows up on the scale. So that could be anything, but I really like dals. I'm an ethnic food enthusiast. So my family is originally from Ghana, West Africa, and that's my first love is Ghanaian food. So if I'm, typically I try not to cook during the midday, but there are times where you'll find me cooking in the middle of the day. I also work from home, so that facilitates that. But if I go into the office or I have to bring my stuff in, maybe some brown rice with some dal, or maybe a Ghanaian dish. I eat a fair amount of pasta. Again, scaling back, moving differently. These days is more yellow pea pasta, which is like 100% yellow pea, more protein, more fiber, more satiety. Not necessarily less carbohydrates, but overall better nutritional profile than our white pasta. And then the dinner time, I'm not like a huge salad person, but I will like certain types of salads. So I'm not vegan. That's like, please don't bring me salad for dinner. Like I'm not into that. A side salad, but not necessarily an entree. But I do like having raw vegetables of some sort with my cooked meals. So we have like a house salad that I make that has romaine and cucumbers and carrots, and basically it's like a rainbow. And I typically make a house dressing. I tend not to buy dressings for the past several years. I like to make my own, whether it's like an oil vinegar based or like a cashew based sort of Caesar type dressing. And I like dessert, but I'm learning again that I can't eat it every day like I used to. maybe just once or twice a week. And I sometimes think about how decadent I'd like to go with it. The brownie a la mode, maybe it's just once a week now, and maybe that scoop of ice cream is just a quarter of a cup. So like these are the adjustments that I make. And the reason why I bring them up is that I'm far from perfect. There's certainly things that I would like to continue to optimize about my health. And there are always opportunities for me. I'm looking at how I'm eating. Sometimes it's the timing, sometimes it's the volume, sometimes it's the frequency. And then, of course, always looking at the quality of what I'm eating and how it's impacting my health. Mm-hmm. So I kind of adjust and flex after. Somewhere in there, my kid goes to school, I work, he comes home, we take him to 50,000 different activities, and, he goes to sleep. So
that's a busy day.
Always.
So, Dr. Abena, I have a question, and it's a little bit of a loaded question because I coach a lot of people both on the consistency of adding plants to their plate, being more physically active, whatever that means to them, achieving a healthful weight for them. But where are we from a healthcare system at prioritizing these conversations rather than putting someone on Ozempic or giving them other medications to treat a disease? How do we encourage everyone, not just women, but to actively prevent a lot of these lifestyle-related diseases that can be, it can be prevented if we make wise choices and we're consistent in our behavior?
Yeah, that's a fantastic question. And it certainly is deserving of a, kind of deep answer. And I'm sure we don't have enough time to go all the way into things, but I would say that both from, where I sit now, which is non-clinical, and my time as a clinician, I will tell you, I think one of the major challenges that we have in our healthcare ecosystem, and I say that because all of the things that interact with healthcare directly, is that preventive services typically are not highly valued.
Yep.
And it's a very broad statement. I'm being intentionally broad, but that shows up in a lot of different ways. So what that means is your physician or healthcare provider, when they see you and they're offering more preventive services than, let's say, procedural services like I used to offer, that's not reimbursed typically well, right? So that time that it takes to provide the education, and it takes time, 10 minutes usually is not going to cut it. 15 is even tough, is not well reimbursed, frankly. And that is the start of a lot of problems because people are not going to put time, energy, and effort into something where there is no return, right? That's the simple truth of the matter. And for whatever reason, I think from a societal standpoint, we have a challenge where we also place more value into the sexy interventions than in prevention. Right? And I'm saying this as someone who did the sexy interventions. You can prevent what I treated all day, but that's not of particular interest. And it's also not where we spend health dollars. People will spend 6 figures at times on a critical care stay. So meaning you have a myocardial infarction, a heart attack out somewhere, you come into the hospital, perhaps it's complicated. 6 figures is not the typical cost, right? But let's say it can get up there if you have a very complicated situation. We will spend that money there, but we won't spend it on what it takes to prevent that person from ever having that event. And the process has to start many decades actually before people start to have it, right? So people start to really manifest it. Well, let me tell you what the teaching was. It was in your 60s. And yeah, that typically is still where we see most people now, but we know that the disease has significantly shifted upstream. I had patients with stents in their 30s, stents, meaning it wasn't their first event. Their children, when I was in medical school, we were taught, and I'm sure you were taught the same, Dr. Daphne, that type 2 diabetes was adult diabetes, right?
Not anymore.
Type 1 was children. And we now know insulin resistance is not necessarily age dependent because we have so much insulin resistance in children now. So think about what that is doing to their blood vessels from age, 10? and beyond, so there's a significant investment that has to be made to prevent disease from ever developing, yet alone from you having events related to disease. But that requires a societal change. And frankly, I think it requires advocacy, not only from people like myself who are in a position where we're working closely with industry, but I think the patients themselves have to say, I want something different. I think that's really the only thing that probably moves things. We've seen that in the oncology space very clearly, the voice of the patient and what it can do from a policy standpoint. But I think that's probably where things would need to go. It's the number one killer, but you would never know it if you were to look into our society, right? So it's really complicated. But if you ask me if there's a single problem, to me, it's this value issue. And then part of it is also maybe how people are impacted by the disease. People who don't have as much voice are disproportionately impacted by cardiovascular diseases. Children, elderly, underserved populations of various sorts, Black people, women, Latinx people, Native Americans. So that also impacts how that is reflected in our society. Right. So the people that don't traditionally have a voice are disproportionately impacted. What does that really mean? Everybody gets cardiovascular disease. It should be a priority to everyone. And I think it's not just my bias as a cardiologist, but we don't see it that way. And we have a lot of work to do. And there's some great organizations that are really trying to, raise the specter and have had that megaphone for a long time. But it is amazing how the society responds. From from where I sit, right? And it's just not the same. So we have a lot of work to do. And I think the first step is to say that preventing disease is as valuable, if not more valuable, than treating it. And, we just haven't gotten there, I think, as a society and as a healthcare ecosystem.
100% agree.
That was my soapbox for today.
No, it's right. And I guess for me, not, me being on the outside of the ecosystem or more of a patient as opposed to a clinician, for me, it's like, why doesn't anybody else know this? And I'm going to get a little controversial here. We talked about, AHA, which is fantastic organization. However, when you go to the recipe section, yes, they promote eating more plants, but then they also provide beef recipes. And so some of these things, I think, again, I'm going to dip into a little controversy, but I'll step right back out of it, is how can, that's to me is not being preventative. I think maybe it would be a bridge to going into more of a plant-based diet, but we aren't necessarily, it's more of a cultural thing as well in our society where, specifically in our country, it's you eat meat, and it's also a status thing. Like I'm going to treat myself because I got a promotion at work or kids got great grades and we're going to go to a steak dinner, and so those are some of the things that I want to hear your thoughts.
No, it's really interesting what you brought up. And I think, there is a fine line with kind of like meeting people where they are. So I told you how long I've been vegan. And if I'm honest about it, I was much younger when I became vegan. It would be significantly harder for me to do that today, right? Just because at this point I've been, vegan longer than I haven't been in my life. But, someone who's middle-aged, it's a challenge. So sometimes I think people are attempting to meet people where they are, which is, if I come at you and I say, don't eat beef, which you shouldn't for many reasons, perhaps I disengage you. Right. And so perhaps, the approach is you eat a little bit less, or maybe you only consider it once a week. You kind of have to build it. But what you mentioned is very true. Food is cultural. And so people tend to get triggered and feel attacked when you come for their food. Okay. Period. Doesn't matter the type of person, doesn't matter where they're from. My people, Ghanaians, if I tell them, hey, you might want to chill on all the palm oil, they will come for me. Now, palm oil is very important in our culture. I use it, but in moderation. But it's also very interesting to know maybe how ethnically our lipid profiles might look and how they look in the modern era based on every other thing that we eat, right? So not just palm oil, but all the other, the processed foods that we ingest. And perhaps how our ancestors ate cannot be how we eat completely. Our ancestors, my ancestors, they tended to be farmers. They were extremely active. And if you look at, for instance, our foodways, and many African people, there's a significant carbohydrate component, right? Which was required to live the lifestyle that they had, which is I need to bulk up on carbs, maybe a little bit of protein. They were truly plant-based foods, to be honest with you, so that I can go and do this very heavy work that I have to do at my farm or hunting or whatever it is. And I eat very small amounts, if any, animal protein. And I move around amazingly, right? My grandmother was still walking for miles deep into her 80s. You cannot take that diet and put it in today's world where I sit at my desk, I sit in my car on the way to work, I sit on the way back, I come home and I sit on the couch. It's a lot of sitting, right? So we need to think about how we adapt our ways of eating as we are moving forward as a society and how things are changing. So it's always something to balance. And for me, I always say I can show you better than I can tell you. If you ask me why my skin is popping, I'm gonna tell you that I was vegan for 25 years, and that's, I've never tried to be too pushy because again, people are very sensitive to this, but I always provide rationale for why I'm doing what I'm doing. I was driven primarily by health to become vegan. And I became far more aware of all of the ethical concerns related to veganism later in my journey, not like right when I started. But that's important. And then you think now about things like carbon emissions, et cetera, and how our foodways impact our environment. It's a much kind of bigger conversation, but I think it's challenging. I am seeing, it's interesting that you brought up the AHA because I happen to work with them a lot, but I am seeing much more integration of plant-based eating and mainstreaming of it beyond, the processed, food sort of access, and in terms of, the promotion of the meatless Mondays. And honestly, when I was still eating meat, I could not imagine a meal without meat. I would probably not have engaged in Meatless Monday. So kudos to everyone who may not identify as being a plant-based eater, but may choose a day of the week to focus on that form of eating. So I think for most people, it has to be stepwise and maybe do like a bit of an elimination diet, but understand your why, I think is the most important. Why are you making the changes? If you're doing it because the cool kids are doing it, it's not going to last, right? If you're doing it because you're thinking about your health and how your health, for instance, impacts your family and your community, perhaps you're going to be driven to stay with it, and continue to make those choices every day until they become a habit and just your way of living. We have a lot of way to go, but I do think, from what I've observed over the past 20 years, we've made some improvements. It's just that it's like we're trying to swallow the ocean. There's so much work to be done.
And kudos to the American College of Cardiology. I mean, they have position papers on the benefits of, I'll just say, adding more plants to your plate, not necessarily being vegan, but a plant-based lifestyle, mainly whole food plant-based. And so hearing it from reputable, hearing it from a group of cardiologists, it's been very refreshing. And I just want to lift them up and say that there's a lot of voices out there that are advocating for this.
And I would agree. And I think one of the major influences there is one of the former presidents of the American College of Cardiology, Dr. Williams, is plant-based. He's vegan, and we do know there's actually a lot of data because physicians will say that we're practicing evidence-based medicine and we're data-driven. There actually is data to support both sides of this. What happens when you eat too much animal protein, and maybe not even too much, just being exposed to animal protein, right? And what happens when you basically base your diet off of plants. This has been studied all over the world, not just in the United States, right? So there's so many examples. But look, let's be real about it. We live in the United States. It's a capitalist society. We also have to contend with the fact that there are industries that lobby a lot for themselves, dairy, the meat producers, et cetera. And it's a business, and they kind of won't stop promoting their business, right? So the plant-based cheerleading, they're not into that. They don't want to hear that. And they get, frankly, I would say upset. Upset is not really the word. They're clearly threatened fiscally when people eat less of their items that we know may not be good for our health, right? So this is the constant push pull that I think we have, and we just sometimes have to reckon with where we live and some of the limitations related to that. But everyone has access to information. The way people like getting on Dr. Google, go on Dr. Google stuff about diet, right? And really learn and go to reputable sources, because there is reputable information. But I think we're heading in the right direction. I just readily admit there is a long way to go. But the more conversations that we have like this, I think the more helpful it becomes, the more accessible it becomes as well. Because I think in some ways, we also have to contend with the fact that there are food deserts, right? I've lived in a food desert before. And Besame and I went to high school together. I can still see me. Okay, I lost everyone's.
That's
video.
Okay.
I did
No,
too.
we hear you now.
We're good.
All right. I don't know if you caught all of that, but just being in a food desert also affects options. So thinking about how you can mitigate that. So this is where people have things like community gardens, et cetera, but realize, well, how often can you garden, right? You only have a few, opportunities during the year, maybe half the year if you really push it into the fall season. And what can you do otherwise, right? Because in some places, let's be real, it's easier to get a chicken box than it is to get greens. And that's another problem that we have in our society, right? It does cost more because the cost of foods that are not good for you is subsidized. That's the frank matter. If you paid the real cost of it, you wouldn't be eating chicken every day.
No, absolutely not.
So it's complicated, but I do feel hopeful that people are kind of becoming more insightful and more attuned to, like, no, I don't have to be committed to just developing heart disease and like having that quadruple bypass when I turn 75. Like, why can't I, live differently and have a different outcome? And it's not just about dying. I always say it's about the quality of your living. Everyone is like, well, everybody's going to die. Well, how are you going to live? And what's the quality of your life while you are alive, right? And so let's make your years as healthy as they can be. And that means eating more plants. It means being more active. It means sleeping. It means getting some Zen, get that meditation on, doing whatever it is to decrease your stress levels, to kind of make you the best version of yourself. We cannot do anything about your genetics. That die was cast, but we can do a lot about what's in your environment, externally and internally. So let's do it.
I love that. How are you going to live? I love that.
Yeah.
So one thing we would love to ask you is, I know you do your meditation, but what's one thing you're grateful for today?
Ooh. I mean, look, I always say I don't look like what I've been through. I'm grateful for life. I'm grateful for my life in particular, because I've been a patient before. I've gone through, health difficulties, and I'm grateful that I could ride my Peloton bike and that I've done it, 500 times, because there was a time in my life where I didn't think I could do that. Right. So I've come a long way, even at this kind of middle age point in my life. And I'm just grateful for good health. If I just want to just focus on myself, there's many things to be grateful for. I do not have a perfect life by any means, but I don't take my health for granted at all. And I don't take my ability to get up and do things for granted. So I'm grateful for that. And I'm grateful for the health of my family and the fact that I have family and I have, a husband and a son. I'm blessed at the end of the day. So I'm always just going to wake up, and give my prayer of thanks for just seeing the next day, because it's not a given. And many people don't get that every single day. Right. So it's as simple as that for me. I'm not too complicated in that way.
That's beautiful. And Dr. Abena, as we wrap up, we always like to ask our guest, and first of all, thank you for being with us today. But
Sure.
we name Perfectly Planted because we want to plant seeds of positivity and empowerment. Is there one seed that you can plant for anyone listening or watching today about how they can focus on their cardiovascular health?
Wow. If there's one seed that I could plant, what I would say is be kind to yourself and apply that broadly. None of us are perfect. And I don't even think perfection is the goal. I'm just trying to get better than I was a year ago, a month ago, a week or two ago, girl. Like, it's sometimes the goals are very short, so be kind to yourself, but think maybe about that one thing that is within reach. Don't create lofty goals, do something that's within reach that you can achieve and be proud of yourself when you get over that hump. If you're on your plant-based journey and you're not there yet, think about maybe how you can eat less processed food and become a bit more whole food plant-based. What does that mean for you? What is it that you really enjoy eating, but perhaps you could make a healthier version of? Sometimes it's just starting with that. And a lot of this is easier if you prepare things for yourself. If that's not your gift, that is fine. But perhaps thinking about how you could improve your skill sets just so that you can have the things that you like. But be kind to yourself, I think, is something, because we beat ourselves up, and it's all women here. I think women are quite prone to this as well. You're trying to do everything and multitask and juggle all the balls. Can't do it all, at least not at the same time. So be kind to yourself. And part of that kindness is taking care of this body, this vessel that we have. Like, you're doing it for you, and it's a good thing to do for yourself. And you shouldn't feel bad about prioritizing your health and prioritizing the things that lead you to have good health.
I love that. So, Dr. Abena, with your new store coming out, you're wearing a gorgeous top. And I've always admired your fashion, your designs that you do. So let's give a little plug out to your store. When it's ready, if it's ready, let us know. We want to help. This
Absolutely.
is not just friends helping friends, but women helping women and supporting each other as well.
No, thank you so much. Abena A Designs is forthcoming. You can follow me on Instagram, and hopefully very soon you'll be able to sign up for my email so that you can be notified when the collection drops. I'll be starting with a small capsule collection, just 5 pieces that are coming in a variety of prints and colors, and then looking to expand with a bigger collection towards the end of 2023. But please, go in and follow on Instagram, and always follow me, Doc Abena, on Instagram as well. And thank you so much for the support. This is a lifelong passion of mine, in terms of being that artsy person who just happened to go to medical school and become a cardiologist. But I'm very much a creative at heart, and it's really wonderful to be able to share what's kind of just been personal for me. I make things for myself, I wear them for myself, wear them myself, but to share with a broader audience and kind of look forward with trepidation to, how things are received, but I'm excited about it. So thank you.
No, I love it. And I think it fuels your joy as well, which I love seeing.
Absolutely.
Yeah. Thank you so much for joining us today, Dr. Abena. We will have a post on our blog, and we'll also make sure we mention your Instagram handle as well. And thank you all for taking the time to join us today for another Sunday Seedling. If you're enjoying Sunday Seedlings, on the Perfectly Planted podcast. Please feel free to share with your friends and family. If you would like to subscribe to our YouTube channel, please do so. Just look for us at Perfectly Planted. Look for our little logo that we've creatively designed. We're going to be having some swag coming out too, and we hope to hear from everyone on comments on our blog and social media platforms. Thanks again, Dr. Abena. We really enjoyed having our conversation today with you, and be well, everyone. We look forward to seeing you all soon.
Thank you. It was a blast.